Here. Let me know when.
We believe that.
So we are live. It'll be, they're going to cue me up, and then when I start talking, we are all on camera.
I am happy to be here.
We're happy to have you.
Yeah. This is the most bustling VA I've seen. I couldn't believe the lobby when I walked in. It's really good.
They kicked me out of hospice because you were coming, so I'm glad to see you here.
Well, that's why I'm late. I just was
Yeah.
sitting upstairs with an amazing Air Force vet. Amazing guy.
Sabo.
Yeah.
Mr. Sabo at the end of the hall.
Yep. You. Feedback.
I don't know about the hat. I'm a Twins fan, so.
Sorry about your bad luck.
That's the best luck we got, so that's saying something.
Yeah, should have waited a few days. You could have went to the game.
I know.
Welcome, everyone. Thanks for being here for a special Veterans Town Hall with Secretary of Veterans Affairs, Denis McDonough. Welcome, sir.
Thank you, Jose. Good to see you.
Good to see you, too. It's my honor to be here with you all today. My name is Jose Llamas. I work in the Veterans Experience Office in Washington, D.C., and I will be your moderator today. So please don't throw anything at me if you have anything to say about me, all right? But before we begin today, I know he's encouraging it. I want to say hello to some special guests. Oh, sorry, my mic is not working. Test. These things happen. Test.
Hit it with a bigger hammer.
A bigger hammer?
You gotta turn it on.
It is. This is my first time.
Yeah, Cleveland, here you gotta turn it on.
There we
Control.
Mic check. 1, 2. Dean, is that good? All right, excellent. Thanks for your patience, everyone. Before we begin, I would like to welcome some very special guests that are joining us this afternoon. Mr. Sean McCarthy, the Assistant Director for the Ohio Department of Veteran Services, is here with us. Ann Longsworth-Orr, the Deputy State Director for Senator Sherrod Brown. Stephen Cook, Military Veteran Outreach Coordinator for Senator J.D. Vance. Kim Edwards, Deputy Chief of Staff, District Director for Representative Chantel Brown. And Suzanne Cox, Constituent Services Director for Representative Troy Balderson. Chad Jimmy, Green and Gold Legislative Aide for Representative Dave Joyce. And Ray Pauletta, District Director, Congressman Max Miller's office. Thank you all for being here. But last, we want to thank the men and women of the Cleveland VA Medical Center for hosting us today. Thank you so much. And a special, really special thank you to Jill Dietrich Mellon, the Executive Director here at the hospital. Thank you for having us. And then also to our live audience right here today, thank you all for taking time out of your day to spend an hour and a half with us. Really appreciate it. And then those for you who are online watching today, thank you for joining in. Today, Secretary McDonough will take questions from you all here in the audience, as well as the folks that you see on the screens behind us. We have 9 veterans from across the country who have submitted their questions via email. Overall, we got over 2,000 questions from veterans all across the country, to include caregivers and survivors. So welcome those who are on the teams ready to ask their questions. For those of you who are in the audience, I know you already did, but if you have your cell phone, please make sure that they're silenced so that we don't have any interruption. Mr. Secretary, before we begin with questions, is there anything that you would like to say before we kick off?
Just 2 things. One, I'm thrilled to be in Cleveland. This is the first time I've been to the Cleveland VA Medical Center. I'm very impressed by what I've seen here, and very proud of the team. Very grateful to the many veterans who have been as generous to me as they have been since I've arrived. So thank you for that. And second of all, I just want to thank, as Jose did, you all for dedicating this time to spend some time down here with me, both those of you in the room and then those of you online. And related to that, I just want to apologize for being late to start, but I was sitting upstairs with an amazing Air Force veteran, and was actually very impactful several minutes for me to sit with him. So forgive me for being late, but I really enjoyed the opportunity to spend some quality time with that veteran upstairs. So with that, Jose, I'm ready to go at it.
Yes, sir. So before we begin, a couple of ground rules for everyone. We really are going to rely on you all here, Anthony, to ask questions of the secretary. But be mindful that we have an hour and a half, which seems like a long time, but it goes by pretty fast. So if you do have a question, raise your hand. And these two gentlemen on the left and right of you with the mics will come up to you, and they'll hand you over the mic to ask your question. Say your name, where you're from, and then go ahead and we'll get to it, okay? So with that, we're going to begin. And I'm going to kick it off.
Okay.
We have an Air Force veteran, Mr. Stephen Knapp, submitted a question to us. And he asked, with all the talk about student loan forgiveness, would it be possible to make it available to veterans also?
Yeah, it's a really good question. That in fact, several of the student loan forgiveness or debt forgiveness programs that the president has exercised are programs that veterans also participate in. And so if there are veterans who are watching today, or who you are talking to, the person who asked the question, for example, on behalf of other veterans, I urge you to be in touch with us at 1-800-MY-VA-411, and we can talk to you about the student loan forgiveness opportunities that there are. I will just say, in particular, especially for those veterans who are VA employees, I want to call your attention to two specific programs. One is the Education Debt Repayment Program, the EDRP, which is a program that's administered by each of our facilities. So if you're a veteran on staff here at the Cleveland VA and you have student loan debt, there is EDRP funding, not a lot, and it gets used up every year because it's such an attractive program, available for veterans. So make sure that you talk to your supervisors about that. Second, there's something called the Public Service Loan Forgiveness Program. That says that if you have been in public service for 10 years, you can get assistance in forgiving your student loan debt. Importantly, an innovation from President Biden is, for veterans, your time in uniform counts to the 10 years for that student loan forgiveness. So if you are a veteran and you have student loan debt, let's make sure that, and we're working with you to count your time in active duty, in uniform, to those necessary 10 years to get you to qualify for that. I hope that answers the question.
Yeah, it does, and I could speak to that as well. I am I received the PSLF, what he just mentioned, forgiveness for my student loans, but I would encourage anybody watching who's interested to go online and just Google PSLF, Public Service Loan Forgiveness, and there's a form that you have to fill out to make sure that you are working in consecutive years of paying into your reimbursement. So yes, thank you, sir, for answering that question. Okay. We are going to go to teams now, so you're going to see somebody pop up on the screen. It's Army veteran DJ Skelton who has a question for the secretary. DJ, go ahead.
Thank you. Mr. Secretary, first, thanks so much for taking the effort and prioritizing coming out and doing these town halls, not just in Cleveland, but around the U.S. To listen and hear from veterans all over. My question involves the VA's community collaborative model that recently rolled out. That program encourages veterans and their families to reach out and to work with the many stakeholders that make up the community collaborative, and that is programs from the VA, from DOD, from state, local governments, from veteran service organizations that may be in the area, from local organizations, civil organizations. That's a lot of business cards. And I know when I was severely wounded, transitioning back, even today, some years later, it's very overwhelming to manage all of these relationships for myself and my family. My question, Mr. Secretary, is the VA providing resources and education to help our veterans and their family members be case managers and to manage these so that they can be very effective relationships to help solve their problems so they can be contributing members to their society and not get overwhelmed?
Yeah, I think it's an awesome question, and thanks very much for it. I want to just respond to your first point, which is I have a very simple equation here, which is I know who nominated me for the job, that's the president. I know who confirmed me for the job, that's the Senate. And I know who I work for, and that's you, and all you in this room. So that's why we do the town halls. That's why I'm here on the road, to make sure that I'm hearing from you about your experience with VA and how we can make VA more effective for you. And so the thanks really goes in the other direction, which is I thank you for taking time to help me think and act in a way that's going to make VA more effective for you. That's one. Two, you know, we think at VA, we like to think, and I think it's true, that when we coordinate care for our veterans, outcomes for our veterans are better, right? That ideally you can get your care in a place where your primary care doc talks to your specialists, you know, where you can get access to mental health care, where you can get access to whole health, you can access to specialty care, and that requires the kind of care coordination that VA has gotten quite good at. And so when we think of that community model, we want to believe that we have people here positioned to help you with that. So a very good example of that is our social workers. And our social workers should be well positioned to be advocates for you and your family as you're, you know, managing these multiple relationships, whether that's for with DOD from one, you know, which you came from, VA, or, you know, Sean is here, I think from the Ohio State Department of Veterans Affairs, and we talk a lot about this, which is we have to make sure that, you know, when you go into your State Department of Veterans Affairs, it's not on you to know whether you're going to a federal agency or a state agency, or whether you're going to a county VSO or your municipal VSO or the American Legion. We got to be coordinated on our side so that there's no wrong door for you to go into. So the idea here, I don't pretend to say that we've got it done perfectly, but the idea is that our social workers, for example, our suicide prevention coordinators, of which there is one in every VA facility, our women's health coordinators for our women veterans, of which there is one in every facility. They're to be that coordinating number for you. So you should really just need their number and then let us do the case management on our side of the street so that you don't have to worry about that. You can just go do what you do, which is continue to make America stronger in every way and in every community across the country, because I've seen this now everywhere I travel. There's great things happening in this country, and everywhere you see behind those great things, there are veterans that are making that happen. So we want you to do that. Let us make sure that our programs are working for you. Let's make sure those coordinators, and if you're not connected with those coordinators, let's make sure that we get you connected with your right social worker there at your CBOC or at your VAMC, and we'll make sure that we're doing that care coordination, that outreach work with you. I hope that it responds to the question.
Yes, thank you so much, Mr. Secretary.
Thank you, DJ. There's also a resource that we use as VA employees of vetted organizations in the communities where you live, and I'm going to give this to you, DJ. You can write this down. It's nrd.gov, and that stands for National Resource Directory. And it's a listing of organizations, as I mentioned, in your communities that work alongside VA. So if you see something in there, you talk to your social worker and see how you can become a part of that organization or get help from them as well. Do we have any audience questions? Right here. Make
Mr.
sure-
Secretary.
What's your
Jerry
name, sir?
Myers, Commander, Post Service Officer, and VAVS rep here at the hospital. I have a two-part question.
Okay.
I was handed this new rule qualifying veterans with bad paper. Can you clarify any of that or give us an input on where that's going?
Yes. Good. Who's with you, Jerry?
My name is Susan Conkey.
Awesome. Glad that you're both here with us. So first thing, welcome home. On behalf of a grateful nation, I say thank you. So secondly, veterans with bad paper. Remember that you retire with an honorable discharge. You have all you need to be enrolled to get enrolled and to qualify for VA. You're dishonorably discharged. Statute is similarly clear, which is you do not qualify for VA benefits. Those veterans with other than honorable discharges, bad paper, we can make you honorable for VA purposes by running a character of discharge review. So what we do is, if there is a veteran who's OTH, has paper other than honorable, but is also not dishonorably discharged, we work through that veteran's history to try to qualify that veteran as honorable for VA purposes.
Okay.
So that new rule is meant to try to clarify what the bars are that say, hey, what kind of conduct is such that you don't qualify for us to recharacterize you.
So, sir, has this rule already been initiated?
We just published that final rule about
Okay.
5 weeks ago, 4 or 5 weeks ago.
Okay. And then my second question, is it true, I'm seeing just one too many venues on it, that the VA is no longer considering a heart attack an emergency?
Oh, let me just be very clear. A heart attack is an emergency.
Not according to, the stuff I've seen.
Yeah,
I've
so
even interviewed a veteran on it.
Yeah, well, Jerry, let's make sure that let's get the specific veteran's case. Let's get to the bottom of this.
Sure.
But, and
That's
we'll correct whatever record we need to correct for that veteran, one.
Okay.
But two, veterans, if you are in an emergency situation, come to the ED, okay? And we'll get you the care. That's the first thing. Secondly, veterans, I want you to know about a new law, okay? This new law says the following. If you're a veteran, whether you are enrolled in VA or not enrolled in VA, your enrollment status at VA has no bearing on this question. If you are a veteran and you are in acute mental health crisis, if you are considering suicide, you can go into any hospital in the country, VA hospital, private hospital, university hospital, Cleveland Clinic, and they will get you care, and we will pay for that. Okay? We've been doing this for just over a year. In the first year that we were doing this, 47,000 veterans took advantage of that important program. Okay? So, yes, a heart attack is an emergency. And if you are experiencing symptoms related to a heart attack, dial 911. Get to the emergency department. We want to care for you. Second very important emergency. A mental health crisis is a crisis, and a crisis is an emergency. Your health is mental health, and mental health is your health. So if you're in crisis, you can call 988, just dial 988, and as a veteran, press 1. We'll get you connected to care today. If you want to see somebody, go to any hospital, and we'll make sure we get you connected to somebody, and we'll pay for that care. Last thing, on characters of discharge. We used to review about 2,000 to 3,000 cases of veterans a year. Last year we did 12,000 reviews of character of discharge, right? Sometimes it may be the veteran that needs us most who has bad paper. And we want to make sure that we can get that veteran status straightened out and we can get them connected to care, okay?
One last thing on that then, Mr. Secretary. For the veteran that goes in and says, you know, let's say it goes to Cleveland Clinic.
Yeah.
The 3 things still follow, whereas he has to notify the VA within 72 hours?
Yes.
Am I correct on that?
Correct.
Okay.
For an emergency room, not for a mental health crisis, right? If you're in a mental health
Okay.
crisis, go in there and we'll get connected with Cleveland Clinic and we'll take care of it.
Okay.
Okay. For if you're going to an emergency room department, emergency room under the VA rules, yeah, the rules are set on that. You got to
Right.
let us know in 72 hours.
Yeah.
Yep.
Well, see, and just backtracking 1 second, the veteran that was in this other affair with the heart attack was out for 3 days. He was unconscious,
Yeah.
and the VA said, we're not picking it up. So just thought I'd let you know.
Yeah, let's make sure that we follow up right after this. We'll take care of it. We'll get into this
Thank you,
program.
sir.
We'll get into this
Thank you.
case.
Next, we're going to go to teams, where Army veteran Landon Brathauer has a question for you, sir. Landon?
Good afternoon, sir. Thank you for taking your time. Landon Brathauer, as mentioned, from Texas. My question is access to care. I recently retired about 3 years ago after about 27 years of service. And what I'm finding, I stayed in the workforce. Now I'm an instructor at a high school. Well, my hours for when I have to come in to when I get off are not conducive to the clinics here in the area. So for me, access to care is hard through the VA system. Though when I'm there, the care is great.
Yeah.
The service and the providers there are good. But I'm hearing this as I get into this community with the VFW American Legion around this area, because I'm in far South Texas, about 3 hours south of San Antonio. It's hard for working veterans because the clinics here don't offer extended hours or even like a once a month, half a day Saturday or anything. It is literally Monday through Friday, 7 to 4:30. That's it.
Yeah.
So my question is there any initiatives out there for those of us who are working full time whose hours don't line up with the VA hours to get care?
It's a great question, Landon, and thank you for your service, and thank you for continuing to serve your country and your community at the school there. They're lucky to have you. You know, we have an aspiration to make sure that we run our programs to fit into your lives rather than expecting you to change your life to fit into our programs. And we don't always do this perfectly. Across the system, we do have established policies where we require extended hour clinics. So evening clinics, weekend clinics. I'm taking for action, checking in on South Texas, so I don't know if you're close to McAllen at all. I was recently at the McAllen Clinic, but wherever you are, we'll make sure that I'm checking into this. Especially given size of facilities, right? We do have expectation that we're offering extended hour clinics. And so I'll make sure that we're living up to those policies, 1. 2, we just completed what we're calling an access sprint. This is an effort that we ran between October and February, October 23, February 24. We just had a very good hiring year. We hired 62,000 people in VHA. We had set out to hire 53,000. So we had a very good hiring year, so we said, let's make sure that those clinicians we've hired are seeing patients. So that access sprint was communicated to the team to say, we need you to focus for this period only on access. We prioritized different specialties and different types of care by facility. But we started with primary care and mental health. Then we extended it to some specialties, including cardiac care. The result there was 11% more unique veteran visits in that window this year relative to last year, and about a 8% reduction in wait time for access to primary care, about a 5% reduction for wait time for access to mental health care, about a 15% reduction in wait time for access to cardiac care. Last point, Landon, because I just want to underscore this. Those are all national averages, and it doesn't mean anything to you if you're not getting in, if we're not making extended hours in South Texas in your region. So the national average is not going to mean anything to you. So let us dig into your case, and I'll follow up with you directly through Jose and the VEO, the Veteran Experience Office. Because again, just to end where I started, our goal is for VA to build programs into your life, not to expect that you're going to change your life to get access to VA programs. These programs exist for one reason. They're for you. So we got to make sure that that's happening. And if it's not, then something's got to change.
Thank you so much.
We'll definitely be in touch. Now let's go to the audience. Any questions? Yes, sir.
Thank you. Bill Navertel. I was drafted into the Army September 10th, 68.
Welcome home.
Well, thank you. I retired from the FAA after 4 decades in air traffic control.
Thanks for continuing your service.
I'm a critical person.
Yes.
And I have to say this about the VA medical, that I'm 100% pleased with the medical side of the house. My wife says I'm alive today because of the VA, because in 2009, I passed out a couple times one day, so I went to Brecksville VA to see my primary care doctor, and she said, I'm sending you by ambulance to Wade Park right now. I thought the lady was a drama queen, but 10 days later I was discharged.
Wow.
My symptoms weren't what I had. In both lungs, it filled up with blood clots with a big clot in the artery between the lungs.
Oof.
I stayed 10 days, no complaints, and I said I'm a critical person. In 20, I had spent 15 days. In 21, 14 days. Again, no complaints. Administrative side of the house, a little different than the medical side, but we won't elaborate on that. But my point is,
No offense taken.
I had to get that in. Finesse isn't one of my strong suits. I'm an advocate for old people to get into the VA. Most of them I meet at breakfast places I attend. Most of them, the veterans, don't go to the VA because they at one time went and were turned down because they made too much money. And these people can't hear. You know, they have all kinds of issues. But since they were turned down once by someone who said, you don't qualify, they won't go back again. Last year I took Alfred, 91 years old, to the VA, who also was turned down because he made too much money. He was a 40-year tool and die maker at the Chrysler plant. Last year, Al got 40% for tinnitus and dual hearing loss. Earlier this year, he got 20% for chemical exposure because he stuck his hands in a tank of acid as an armament specialist, and he got badly burned. The VA couldn't find his records, and even when we first applied, we couldn't apply for the chemical exposure because they didn't have his Alaska records. They since found the Alaska records because somebody exerted a little effort. As a career government employee, I know not all government employees are created equal, and the less you do, the less chance you have to mistake. Alfred's been very, very positive, and he sings the praises of the VA because they spend time with him. His first appointment was an hour and a half. First thing the doctor did was question why Al was on some medication. He said because the Cleveland Clinic doctor gave it to him. Al changed it up, and he doesn't have any more kidney or bladder inspections that he has every 6 months. And he speaks very highly of it. And I think the VA in all their marketing is missing a lot by not targeting these older people who can be found at any Greasy Spoon restaurant, throughout northern Ohio, because they have plenty of time. And I would like Alfred to, and thanks for taking my time, to say a couple words, because he might be 92, but he's very affluent.
Love it.
Al. Face the crowd.
Well, I can say one thing. Oh, excuse me. I can say one thing. At 92, I'm very important to a lot of people, especially ugly women. I am so thankful for the VA. I had problem with my bladder almost for years, and the Cleveland Clinic, they would give me antibiotics, and then a few weeks later, it came all back. I went to the VA last year, and the Dr. Hassman prescribed a new medication, and I'm all clear. I can pee like a little bear, So I am very thankful, and I get compensated for my burn marks. Actually, the doctor beautified me. He beautified my face. I had a little ugly face, and people actually envy me at 92. They burned the skin cancer.
Amazing.
So I am a very happy veteran, and I'm proud to be a member of you people. Thank you.
And we lined him up with the public affairs officer here, and they're going to do a video on him. So more to come.
I just want to say a couple things. It may be that, Alfred, that you got the additional 20% service connection for exposure to that acid on account of the PACT Act, the Toxic Exposure Law. Okay? That law has established service connections with more than 30 conditions, including, importantly for our Vietnam veteran cohort, if you have hypertension today and you are exposed to Agent Orange, that hypertension is now can be presumed service connected. And because of that provision of the PACT Act, this new law, the Toxic Exposure Law, we have many new Vietnam veterans getting care at VA for the first time. And they may have been told, as too many were when they returned home in the 60s and 70s, they were turned away. But this new law ensures that there is increased access for veterans. Second part of that law says if you are a post 9/11 veteran and you're in any of the named operations, Operation New Dawn, Operation Enduring Freedom, Operation Iraqi Freedom, any of those operations, not just in Central Command, that AOR from Somalia in the southwest to Uzbekistan in the northeast, from Yemen in the southeast to Syria in the northwest, and all those garden spots in between, like Iraq and Afghanistan. Every veteran of those conflicts is now eligible for care, but also veterans of those conflicts and those operations in North Africa and West Africa, in Southeast Asia, are also now eligible for care. Lastly, post 9/11 veterans who did not deploy overseas, but who during training, while on active duty, as happened to Alfred, were exposed to certain toxins, asbestos, lead, nuclear weapons, heavy paint. You also now qualify for care. okay? That whole last portion of veterans who are now eligible for care, that's a self-attesting set of requirements. You just need to attest it to it. We'll establish a connection. We'll go back to get the records. We just need you to attest to that. And about 15,000 veterans have now signed up for this expanded access to care since March 5th when this all started. This expanded eligibility started. Last point. There's another new law that says if you are a World War II vet, and you might be at the greasy spoon, every World War II vet now qualifies for care at VA. Every single World War II vet today qualifies for care at VA. Okay? So those are just some examples of new eligibility, new enrollment possibilities for VA. It could be, by the way, that we had a shot at you before and we mishandled it. This happened with a lot of our women veterans. This happened with a lot of our Vietnam veterans. We did not treat you the way we should have treated you. So we're asking you to give us another shot under these new eligibility rules because we really want you in our care. And when you're in our care, every study says that you do better, as I think Alfred's story just showed us.
What surprised me, we filed that acid claim. 2 weeks later, we had the comp and pen hearing. And within a month, from the time we filed, he was declared 20% for,
Yeah.
and I had filed claims when George W. Bush was president. It sat through his first term, his second term, both terms of President Obama, and in President Trump's second year, they started getting approved. So that lightning speed really showed some efficiency.
Thank you for sharing that. And then I will mention also, the Secretary mentioned PACT Act. For those of you who do not know what that is, just go online. It's PACT, ACT. Google it. It'll take you to where you need to go. And all the information that the Secretary just mentioned is right there for you to read for yourself, okay? So just wanted to share that with everyone. We're going to go to teams right now, to Navy veteran Sherry Hansen. Sherry, when you're ready, go ahead and ask your question.
Thank you so much. Good afternoon, Secretary McDonough. I am just thrilled to be able to chat with you today. My question is around those veterans who are suffering from either substance use abuse or mental health. Those are veterans that I help advocate for, and we've seen the wait times, in particular with those with substance use abuse, well over 30 days after they raise their hand for help. And I would like to know if there's anything that we can do to help improve that process, as well as those who are in mental health. I know you shared the crisis with the PACT Act, which is fabulous. It's just not being implemented across the U.S. the same as it is in every state. So anything that you could share with me on how we can help veterans with substance abuse and with mental health would be greatly appreciated.
Awesome question, Sherry. Thank you very much for that. Just on your last point about the PACT Act, now don't confuse this with the PACT Act, and I'll stop using all these names, but the emergency access to hospitals, to emergency rooms, if you are in acute mental health crisis, is a new program, and I think you're absolutely right. The data does show it to us as well, Sherry, that it's being implemented. We got a lot of learning to do, and so it's implemented unevenly across the system. And so we're getting better at it. I think a meaningful thing is that more than 47,000 veterans availed themselves of it. Now, my fear is that there are some quantum above the 47,000 who tried and got turned away or something. So we just got to get better at it, and we will. We do get better over time. So I take the point, and I don't mean to say it's perfect, but we do want to get better at it. And this is why, again, it's so important to be out here hearing from you about your real life experiences. Second point, we are very concerned about timely access to inpatient mental health care and inpatient substance use disorder treatment. We feel very strongly that we do those things well in VA, and we have residential mental health care facilities and residential substance use disorder treatment facilities. And slowly, you know, we had really skinnied those down because of COVID. And, you know, some of those are older facilities, so they're shared rooms. And what we couldn't do is, in the midst of the pandemic, we couldn't have two vets in the same room for fear that they would contract COVID. We're slowly lifting those limitations and hiring back the people that we need to run those facilities, which is the other rate limiter to get into the VA facilities, which is we still have vacancies. We still have to hire up people to make sure we can run those places. So we feel very proud about our infrastructure. We feel very proud about our programming. We think veterans do well in it when they're in it. We just have to expand access to it. And we're working that. Third point, when we can't get them timely access to our facilities, we have to get them into private-run facilities. And this, too, we do an uneven job at, right? And I think that's what you're experiencing, Sherry, and I'm really glad that you've raised this for us. And over the course of the last year and a half, we've looked at this to establish new policies and procedures to ensure that we can make that decision much more quickly, because when somebody, for example, look, I know I'm an Irish-American kid. I have 10 brothers and sisters, okay? You know what that means? I know something about alcoholism, okay? Right? I know something about treatment. And when somebody's ready to get into treatment, that doesn't last forever. So when that veteran is ready to get into treatment, we gotta make sure that they can get there. And this is the kind of work I know you do, Sherry, and we really appreciate it. And so we are looking at those policies and procedures. We used to have a much longer timeline during which we would try to find that veteran a placement in the community. We are shrinking that timeline to make that happen faster. It's not going to be perfect overnight. It's not perfect today. It's getting better. And importantly, we've established a new target for ourselves so that we can get that veteran into care, whether that be in the VA system or through the community, so that when that veteran decides, you know what, I want to get into recovery, we can get them into recovery. I hope that answers the question, Sherry.
Oh, it does. Thank you. And just one last piece, if you could share what you're doing to help women in that type of situation specifically.
Yeah. Well, so we are trying to make, this is one of the reasons that we're looking at our facilities, is because we also want women to be able to go, women veterans who are ready to go to treatment, be able to go to treatment in places where they feel safe. And whether that's in a VA facility, so they can be in a women's only facility, or whether it's in the community, same. And so we are prioritizing the fastest growing cadre of veterans in the VA system, women, right? That's only going to be accelerated by this new toxic exposure law, right? Because you know what happened in those years after 9/11? The force has become increasingly gender diverse. There are more and more women in the force. So we just have to catch up at VA with better access for women veterans. We just came from the Women's Health Exchange across the street, or under a parking lot, whatever it was. Felt like it was a little bit of a walk, right? Beautiful facility. Assures women veterans their own access, so they don't not getting catcalled. By the way, you see anybody catcalling our women veterans, straighten them out, will you? Yeah. That doesn't happen here. You can get away with that crap, right? Not in the 21st century. Not when those women have sacrificed so much for us, right? Let's make sure they have a safe place to get their care.
Thank you, Sherry. We have a question right up here in the front.
What's your name? You're good, man. We're here together.
Yeah, take your time.
You're good. What's your name?
My name is Dwayne.
Good to meet you, Dwayne. I'm
Last
Denis.
name is Parrish.
Good to meet you, Dwayne Parrish. You a Marine, huh? You were in Beirut with the Marines?
And earlier you mentioned October 23rd.
Yeah,
You know maybe what happened in 83.
I do.
But not enough is mentioned about our situation. You hear to World War I, II, Korea, Vietnam. Then it's always Iraqi this, and there's a storm and stuff like that. But if you look at a lot of the paperwork and literature and stuff that's down here at the VA hospital, people that were in Beirut we're not recognized like everybody else. It's just not. There's something need to be done because we were involved in a conflict, war, whatever people might want to consider it. But like I said, an awful lot is not being recognized and done for us. And
Yeah.
I think even you look at some of the stuff on the walls, stationery, it's nothing mentioned about us. And I just leave it at that as far as like, I get too emotional about
Yeah,
October 23rd. You just mentioned it earlier. So
yeah, yeah. Well, let me tell you that. I know what happened on October 23rd, 1983, right? The most,
6 Marines and stuff.
yeah, most deadly attack on Marines in a long time. A dastardly one at that, terrorist attack.
Not
And-
even recognized.
Yeah, well, I'm telling you right now, I recognize you, Mr. Parrish, and we want to be partner with you. Okay, we want to make sure you get the care and the benefits that you've earned, and the amazing things that you and your Marines did over there, and that dastardly attack, right? So let's make sure that if you're not getting the care you need, let's make sure we get that for you. All right. And I appreciate you coming out today, and I appreciate all that you've done for us, Marine.
Yeah, thank you, Marine, for standing up. Appreciate that. We're going to go to teams next. Coast Guard veteran John Hill. John, when you're ready, you can ask your question.
Yes. Hello. Thank you for your time this afternoon, Secretary. And my question for you is that I've been going to the VA for quite some time, happy with the help that I get from them. But one of the things that I've run into is that prior to 1985, the Coast Guard, as standard operating procedure, physically destroyed the small boat records. And so they are not archived in anywhere in any shape or form. So when I go to the VA and apply for a disability, they say, sorry, we can't, you're denied because we can't find the records. And we will continue to look for the records, even though they know there are no records to be found. And so I've gone through all of the doctors, the CNPs, I meet all the nexus and all the stressors, but I'm continually denied because they can't find those records that they know were physically destroyed as operating procedure before 1985 with the Coast Guard. What options do I have, and how do I get help from you?
Yeah. Well, John, thanks very much for raising it. It must be a massive frustration. And I confess that I didn't know about this until I was coming out here to get ready for this town hall. So you have my commitment that I'll raise this with the Department of Homeland Security, which oversees the Coast Guard, and I'll raise it with Undersecretary Jacobs, who runs the Veterans Benefits Administration, and let us figure out a methodology that will allow us to accommodate what's an historic fact, which is that there are not records. And you know, we've been able to work through situations where, for example, the National Personnel Records Center lost reams and reams and reams of records for some of our Vietnam and earlier era vets. So we were able to come up with a methodology there. So my commitment to you is that I'll work with Undersecretary Jacobs and VBA and with the Department of Homeland Security, which is where Coast Guard resides, and we'll figure out a way to address this, because it's just not tenable that because of a policy on treatment of records that you don't get your service connection. So we'll figure this out.
I have worked closely with everybody that I can come up with, and the problem that they keep coming back to is that there are no records. So now I'm been put on the docket to see a judge, an arbitrary, to arbitrate it, but they said fast track. It'll be 4 years before I get to see that individual, and I've already been dealing with this for 13 years.
Yeah.
And I'm 69 years old. So
you're sick and tired of it.
Any help would be very helpful and appreciative. And it's
John,
not just there are thousands of Coast Guard veterans that were before 1985
correct.
That would be concerned with this.
Correct. Yeah, so I appreciate you raising it. The judge, is that at the Veteran Board of Appeals, or is that a different judge you're talking about?
Yeah, the Board of Appeals.
Okay, I'm going to find out why they would tell you 4 years. There's no way that they know that fact. So I'll follow up with the chairman of the board as well. Okay, so we've obviously got your contact data, so we'll work this. Thank you for raising it.
We'll get back to you. Thank you for bringing it up. Anyone from the audience? Got several folks in the back.
Hello, good afternoon. I'm Crystal Kent, Army veteran and founder of Veteran Voices for Fibromyalgia. And I kind of want to piggyback on the last question just to make you all aware that Senator Tester has introduced legislation to address the lost records issue, the Fred Hamilton Veteran Lost Records Act, which would also affect me because in 2011, the Department of the Army lost my records. So I can feel some of that pain trying to get service connected for conditions, and then they come back and say, well, your records are silent, and I show them the documentation from the Department of the Army that my records were lost as it was identified, but it turned out that the vehicle, the armored vehicle to transport the military documents, was stolen. So I've run into that issue for the past 13 years. So I actually have a question about the expansion of technology for telehealth medical services. And you stated earlier you appreciate hearing our personal experiences. And for myself, on 3 different occasions, my medical providers at the VA failed to provide me my appointments through scheduled telehealth medical appointments. And as a result, I ran out of medications, which was an anxiety medication. And even the pharmacy couldn't get a hold of the provider either. And I was out without my medication for 10 days. This happened 3 times to me. And I'm one of those people, I don't bring an issue up without trying to investigate it or resolve it or bring ideas to the table to address it. So through my organization, we did an independent poll of a small sample of veterans, 512, and asked if they had ever experienced where they had a scheduled telehealth medical appointment and if their provider did not make that appointment, like they couldn't connect due to technology or they didn't show. And 62% of the veterans polled reported that they had their telehealth appointment provider not show for their appointment. And of that, 52% reported they needed a medication refill and did not receive it, the refill, because the provider did not provide the service through the VA telehealth program. So I don't want to present a problem and say, hey, fix this, but how can we partner together to address this and maybe investigate this a little bit further to see how widespread it is? And then come up with some backup plans or strategies. So for my instance, I called everybody under the sun at the VA to get my medication. I have everything in writing. I can give it to you. I literally spoke with like 5 people in the department, and I kept saying, I need my medicine filled. Is there a prescriber on staff today that could do an emergency refill? And they just kept moving me back and forth to different people. I reached out to the pharmacy, and they were fantastic. But they weren't getting a response either for 6 days. So I would like to maybe further this discussion at another time and see how can we address this, investigate it further, and provide strategies in place when technology, we can't control it. It's going to fail at times. And so what are those backup plans to ensure our veterans are receiving the care they deserve and definitely need, and also ensure continuity of care and that they have their refills?
It's a really good. I think we should continue the conversation, and I'm sorry that you experienced that. It sounds like multi-system failure. So let's continue the conversation. I'd love to take the information you have when I walk out today too. Okay, thank you.
Thank you. This gentleman in the DAV had a question.
Good evening, Mr. Secretary.
Good evening.
Thank you for coming out and sharing with us. And she hit on one of the topics that I wanted to talk about, was the telehealth. And I did file a complaint here at the VA. I had an appointment, and my provider did not contact me or do anything to try to get in touch with me. But then he wrote up some information in my file that he had spoke to me and didn't. And then when I went to volunteer to complain about it, and then it went up the chain of command, it came back denied and said they didn't find anything wrong, and for me to keep filing complaints. Now my other complaint is I had all my teeth removed in the dental service, and when come time for me to get dentures, my dentist suggested that I get implants. I replied to him, I did not want implants. I had had enough pain in my mouth. I prefer dentures. So when I said that, he looked at my gums again. He told me I needed surgery in order to make the dentures work. I went outside and got a second opinion, and I asked that dentist the same thing, did I need surgery? The answer was no. So it's like I'm being denied service that I earned. I'm a Vietnam veteran. I did time in Vietnam. I come home, I joined the Ohio Army National Guard. I did 21 years there. I've served my communities through churches, other organizations and all. I've worked hard to be an upright citizen and especially represent the veteran world. And I would like to know what can I do to get my dentures replaced. I only had the top, but I need, and it's been so long, I need a whole new set of dentures.
Yeah, yeah.
And the reason I didn't want implants, I've had enough pain in my mouth.
Yeah, I hear you.
I'm 72 years old.
Yeah.
And I just need something to chew my food where I can digest it. That's all I need.
Fair enough.
And so if you can look into that, I really appreciate it.
Count on that. I say welcome home, first of all. Thank you thank you for your service in Vietnam.
Thank
and let's make sure that we follow up directly with you before we go.
Thank you.
Okay?
Thank you. We're going to go back to teams with Marine Corps veteran Gary Foster. Gary, when you're ready, go ahead and ask your question.
Yes, good afternoon, Mr. Secretary.
Hello, Mr. Foster.
It's a great honor to be here today, and I'd like to give a personal thanks to Dr. Shaw and her team at the San Luis Obispo VA Clinic for their many years of dedication to all of us veterans.
Awesome.
So my question today addresses a subject that most people are probably not aware of. At age 65, we're required to enroll with Medicare. If you have qualifying Medicare coverage, medical coverage, you can delay enrolling with Medicare without penalty. But Medicare doesn't recognize VA medical as credible coverage for Part B medical. And the penalty is stiff. It's 5% a year for every year unenrolled, and the penalties never go away. The irony is Medicare does recognize VA medical coverage as credible for the purpose of Part D prescription drug coverage, and veterans are not subject to such penalties. The second irony is the federal government also recognizes VA medical coverage as credible. Every year, veterans submit with their federal tax filings proof of health care coverage on Form 1095B, listing the VA as their only health care provider. So how is it that Medicare can make a ruling that VA health care isn't credible coverage? As a result, veterans sign up for Medicare and they're paying twice for their health care. I say twice because they've already paid for their VA coverage. Look, it's not like VA benefits are free. Veterans benefits have been paid for with the blood of young Americans for the past 250 years. And the installments continue to this day. I realize the Veterans Administration isn't responsible for Medicare rules, but this unjust burden on senior veterans needs to be corrected. And I thank you again for having me today.
Thank you so much, Mr. Foster. Who's that handsome vet, handsome Marine over your left shoulder there?
That's me, a long time ago.
I kind of figured as much.
1970.
Awesome, awesome. Well, thank you for the question.
Off to my right is my father, and who served during World War II in the South Pacific.
Awesome. What a family of service. That's amazing. Thank you. On your specific question, I have to confess that I don't know why CMS, the Center for Medicare Services, does that, but I will get you an answer. And it seems like I don't disagree with your analysis at all. Neither do I disagree with that your conclusion that it's unjust and that it's inaccurate. So let me find the answer to that question. I'm 99% certain that the answer lies in the fact that the statute requires it to be so, but let me confirm that and let me send you a note on this, and then we'll see what we can do about it.
Thank you very much. I appreciate it, sir.
Thank you.
Thank you, Mr. Foster. We will definitely be in touch with you after this. Thank you. Yes, right here. Thank you.
Hi, my name is Amber Simicek. I'm an Army veteran as well as an employee here.
Awesome.
I'm glad to hear that there's a lot of hiring going on. Unfortunately, we're not seeing it here, and there's been a hiring freeze. However, I did want to respond to the gentleman in Texas that I heard earlier that we at least still can provide services on the weekends in physical therapy work, and then we can do some early appointments and late appointments. I'm hoping that'll bring him some hope. But despite all that, it's still, our wait times are getting longer out there with the hiring freeze. I was wondering if you know anything about that in this region.
Sure. Yeah, so I think what I said about the hiring is that we had a very good hiring year last year, right? And I don't think you disagree with that. I think you guys had a good one here too. As I said, we hired 62,000 in VHA last year. We hired about 6,000 in VBA last year. And so that's what I was referring to. And the access sprints that I also mentioned referred to the fact that we've challenged our providers to bias toward access, right? And that's why we had that sprint, which is continuing in many facilities. Some of the attributes of that sprint were evening clinics and weekend clinics, so extra hour clinics. And I think you guys do those as a matter of course here. And, you know, I think Mr. Breithauer or Bretthauer could conceivably access telehealth options for an evening or weekend clinic, but I think he wants to be seen in person is how I interpreted the question, and I think that's a reasonable demand. So that's why we're going to check in on that. Now, as it relates to the hiring freeze. Now, we I want to be careful not to make this like an argument about semantics, right? What I say is that we're in a period of what we call strategic hiring, which is trying to prioritize access, trying to make best use of the clinicians we've hired over these last 3 years of record hiring. And continuing to hire in those strategic areas where we need that hiring. So let me give you 2 examples. Mental health care, where there's just no doubt that we need, as every healthcare system in the country needs, additional mental health care professionals. And SCI, spinal cord injury clinicians, which is a particular expertise and need for VA. We're further saying that our healthcare systems should otherwise seek to have net zero increase on FTE billets, right? Now, you know, we've established this across the system, and just this last pay period is the first time we've seen a reduction in FTEs anywhere. And in fact, we're up right now about 6% on where we were on October 1st. So the system, which is 452,000 people, has grown 6% since October. So I really regret that you're feeling the pinch in your component, but it's not accurate to say that we're in a freeze. We're not. Lastly, why are we focused on staffing at all, right? Because for 3 years, I've said every year is going to be the best hiring year we've ever had. And for 3 years in a row, that was true, right? And I'm really proud of that. But now we have a budget cap. And that budget cap, it's a very generous budget. But we have gotten used to growing in our budget at something like 9% a year in healthcare, right? But we're not growing at 9% more veterans a year. We're just providing more care, more complex care, as our veterans become more reliant on us and as our veterans age. You know, the average patient in VA is 60 years old. That, you know, 60% of our patients are 60 years old. And as you get older, your care is going to be more expensive. So it's going to get more expensive. But when you're under a budget cap, we got to figure out where do we make savings, because this budget cap, if I watch Washington debates, there was a budget agreement between President Biden and the Speaker of the House. In as much as there was objection to that agreement, it's that people wanted it lower. Not that they want it higher. So a prudent thing for us to do is to say, okay, if the cap we have now, which is pretty tight, looks like it's probably going to continue, we have to figure out how to get lean. And there's two big areas that we have to make sure that we're being very, very prudent on spending the money. One is when we make referrals into the community, right? We're growing at 17% a year in community care. There's not a healthcare system in the country that's growing at 17% a year. Not a single one. Not Cleveland Clinic, not Mayo Clinic. That's fast growth. So we've said, let's try 15%, right? So that's the first thing we're trying to do. The other big expenditure we have is per people. People provide care, right? So we have to maximize the amount of care we provide, right? That's why we hired all these people. And then we have to make sure that when we're referring veterans to the community, when we purchase care, we're being prudent about that too. So operating under this budget cap, we have very aggressive goals in both of those. The extent to which we don't reduce referrals to the community, then we have to reduce our personnel more. If we don't reduce our personnel enough, then we'll have to reduce referrals to the community. Now, the good news is we're providing more care and more benefits to more veterans than ever in the history of VA. And we're doing that at a higher satisfaction rating for veterans than ever. 91.7% satisfaction among veterans. Now, I never got 91.7% as a student. There was more 7s than 9s for me. I was a 70% student. But there's still headroom for us to grow, right? We just have to be really lean about how we do this. And I think we can do it. And I've seen it here all day. As I look at the strategic plan that you have here in Cleveland, including making sure that we're bringing cancer care closer to patients so they don't have to drive all the way downtown. Maybe they can stay up in Ashtabula, right? Or down in Akron and get their care down there rather than getting their car and driving all the way in town as you guys just did, right? That's a good thing. So that's what we're trying to do. So hiring freeze, no. But pressure to make sure that we're really prudent about hiring, yes. And are we going to restrict veterans' options to go to the community? Absolutely not. But we're going to say every time that we refer you to the community, hey, if you want to stay with us, here's an option for you to stay with us. Because you know what? We really want you to get your care here. At the end of the day, that's a decision you'll make with your doc. But I want every time us to be competing to say, you know what? We want you to get your care here. I hope that answers the question.
Thanks for the question, and thanks for choosing to work here.
Here,
at the
here.
VA. Yeah. Let's go to teams, to Army veteran Domingo Ortega. Domingo, when you're ready, go ahead and ask your question.
Hello, Mr. Secretary, and thank you for being here, your transparency and opportunity to ask my question.
Thank you so much, Domingo. It's a thrill to get to work here, and I'm thrilled that you're giving us time to share this feedback with me.
Thank you, sir. In order to eliminate fraud and expedite disability benefits, could the VA doctors submit medical evidence? Otherwise, veterans are paying thousands of dollars for nexus letters.
Yeah. I think it's a really good question, and I'm surprised how often I get it. In fact, it kind of chaps my butt that I get it this much because I wish it were more straightforward. So I'm sorry, Domingo, that this happened to you as it's happened to so many veterans. The expectation is that our docs fill out DBQs, okay? So the expectation is that they find time to do that. Now, there's a lot of pressure on our docs, as I just talked about, on all of our clinicians, right? We're operating in a tighter budget system right now, budget picture right now. We're trying to get more veterans into our care. 550 times the rest of this year, we're going to have outreach events with one goal in mind, to convince veterans to join us. We want to have a relationship with all 19 million veterans in this system, in this country. I'm thrilled with the relationship that we have with about 11 million. It's just 8 million that should have a relationship with us, right? So there's a lot of demands on our system, but we should be providing support for you on things like DBQs, 1. 2, if you are seeing a VA doc and you file a claim, make sure that, and we will make sure that, working with your VSO, that the record underscores that you're a patient at VA, which allows the claims rater to then go to the VA and get your record and bring it back, right? Which might, at the end of the day, be much more meaningful than the nexus letter from some doc that doesn't know you, okay? So let us do the work for you. Make sure that we're filling out the DBQs. I'll keep pressing on my side to do that. Make sure that as you're filing, or as you're talking to your buddies, or as you're talking to your VSOs, make sure that the VSOs know that the expectation is that we fill out the DBQ for you. Lastly, if you are getting your care with us, let's make sure that we know that. So we know to go ask for your record at, for example, the Cleveland VAMC. And then we can make sure that we complete the record. We're just about to our 1 millionth claim awarded under the PACT Act, right? In the last year, there's 30% more claims filed in 2023 than in 2022. And guess what? 2022 was the most claims ever filed. 2023, 30% more claims filed than 2022. This year, we're on pace to file 15% more claims than last year. Okay? More claims is what we want. We want to work through those claims to try to get those decisions for you, right? Not only are there more claims, but we're resolving them more quickly. But more quickly still means 157 days on average. It's a long time. Now that's to resolve every contention in a claim. And as you know, in every claim there's 3, 4, 5, 6, 7 contentions. So we're working through these. We're working through them more aggressively, but it still takes too long, 157 days, right, on average. Now, not everyone. Sounds like Elford's went pretty quick, right? But I guarantee there's somebody in this crowd who had longer than 157 days, right? So we got to get better at it. We'll stay on top of it. But please don't be dissuaded by these numbers. Please don't be dissuaded from submitting your claim. We want that claim. We'll work through that claim. And the reason it takes 157 days, even though we have more people working these claims, is because we're going to go get that record, which might take a little bit extra time to get to yes, rather than to get to a quicker no, right? And you putting that kind of information into the claim will ensure that we do that. I hope that's responsive, Domingo.
It is, Mr. Secretary, and thank you again. I appreciate you.
Thank you, Domingo. And I'll add 2 things. For those of you in the audience and those for you online who don't know what a DBQ is, it's a disability benefits questionnaire. So if you want to Google that, you'll know what it is. And the second thing I'll add, sir, is we are doing outreach events all over the country. As you know, you've mandated these to happen all over the country. If you want to know where an outreach event is taking place, maybe in your hometown, maybe close to where you live, just go on va.gov and you can Google on there, search on there, outreach events, and we list everything online live every single day, and it's always changing. So I encourage you to go online, va.gov, and look for that event near you, okay?
And those events, the reason why the events are important is, one, we want to meet vets, especially those not yet tethered to VA. Two, there's claims raters there. Three, there are not at everyone, but often C&P examiners there, okay? And there's VHA clinicians there. So not only we want to get to know you, not only we want to get you to fill out your paperwork, we want to work with you to fill it out. And then we want to get you into a C&P exam, right? Last summer at each of the VSO annual conventions, we had veterans come to the convention with no relationship with the VA, file a claim, get a C&P exam, and leave the convention with their service connection rating. Not everyone did, okay, but some did. It's because we want our programs to fit into your life. We don't want to and expect you to change your life to fit into our programs. Not perfect by any means, I'm not saying that. But we are working at this because we know who we work for, and we work for you. We also know that sometimes we kind of, I was about to swear, but I'm not gonna. Sometimes we mess it up. You know what I was about to say. We sometimes mess it up, but we're getting better at that. And don't mistake our intention. Our intention is for a relationship with you and for us to make sure that these programs work for you, that we work for you, okay?
Yeah, take advantage of those opportunities and meet with a VA person one-on-one at one of these outreach events. And they're listed online on va.gov.
I thought they were here.
You talking about folks here?
I thought that you meant that they were here at this event. No?
No, we have folks that are here. Obviously, this is the hospital. I'm talking about people who are watching right now in their communities all across the country. We're doing outreach events. So
We did not make this town hall at one of our outreach events. You're right. And maybe we could have. In retrospect, that's my fault. But so the outreach events we're talking about are a lot less talking and like from blowhards like me, and a lot more doing from our claims raters and others. Okay.
Thank you, sir.
Good.
We have a question in the back. The gentleman right there, right next to the pillar. Right here with this hat on. Can't see. I'm sorry. It's coming.
The mic's coming to you.
A couple of questions. That those outreach events, are you gonna have one scheduled here in the near future?
You know what we'll do is, go ahead. August 3rd in Akron, Ohio.
Now that's maybe be a task for me to get down there.
Okay. Well, let's figure out how we can get in touch, direct touch with you then, if there's something you want to work on.
And second, I have a couple of other questions. That you was talking about the character of discharge review.
Yes.
Is there a telephone number or a website that I can go to?
That is a very good question, and I should know the answer to it, but I don't. But let's just make sure that I get your contact data before we go. If you can leave it with Jose and his team.
I'll help you.
I will.
We'll get to you on that.
Okay.
Should be on the rule itself, but I'll find that out.
Okay, thank you.
Well, ladies and gentlemen, I'm sorry. Our time has come to a close. The boss has to get to the airport. He's headed to Minneapolis for the PVA National Convention. So I would apologize to everyone who's waiting online as well. We will get answers to your questions, and we really appreciate you standing by, waiting to ask your question. Sir, before we cut off, anything you'd like to add in
Well,
closing?
when I'm in Minneapolis, I'll check in on how my twins are doing. See if they're catching those guardians yet. I'm also gonna, after spending time tomorrow with the PVA, I'm gonna go catch myself some walleye. But I end where I started, right? Which is we're here because we want to hear from you about your experience. Some of these experiences are extraordinarily painful and very substandard. And we want to make sure that we get better. Your feedback, your candor with me gives us that opportunity to do that. So I really appreciate everybody getting on with us either virtually or those of you who came into the room, I thank you very much. Thank you for your awesome service to this country. Thank you for choosing VA, and let's make sure that we're doing our part to fit our programs into your life. Okay? Thanks so much.
Thank you, sir, for being with us. Everyone, thank you so much. And those online watching, have a great day. Safe travels if you're coming here or leaving.
That our team follows up with each of the people who I said I'd get your numbers and so that we can follow up with you. Okay? The fact that I'm going to run to catch my plane, I don't want you to think I'm forgetting you. Okay?
You don't have your own jet?
I wish. Yeah. You know what it's called? It's called American Airlines, brother.